Hello, everyone. I'm excited to come into you via video to talk a little bit about your memory. So my presentation today is called Getting an A for Your Memory. And I've done this presentation before, but typically in a room full of people. We're doing it a little bit differently now because we're in unprecedented times. But when I've done this before, there's a lot of audience participation. So I'm going to challenge all of you who are viewing this to grab a piece of paper and a pen and to treat this like a quiz. Right? I'm hoping that you'll all score well, but my plan is to make you think about what you think the answers to my questions will be. And then I'm going to try and teach you a little bit about what might be able to keep your memory as strong as possible for as long as possible. So as we move along, I'm going to keep referring back to what your questions are and what your notes are. So let's go ahead and take the first slide. So as a geriatrician, I get this question, as you can probably imagine, all the time. Is this blank thing that's happening to me normal for my memory, or should I be worried? A lot of people, and for good reason, are worried about cognitive compromise and worried about the risk of developing Alzheimer's disease. So let's take a minute in your, with your piece of paper and your pencil and look through this list and tell me, just sort of mark off the ones you think are worrisome and the ones that you think are normal. And then I'll give you a minute and then we'll go through that. So forgetting someone's name, thankfully, this is normal, and I do this all the time. A lot of people do. So if it's someone that you have not met very often and you meet them again, or someone that you've been introduced to once and you forget their name, completely normal thing to do. What's not normal is forgetting the name of a significant family member, forgetting the name of someone that you've known for many years, for a very long time. That's sort of a more late stage memory change, not something you see right up front, but definitely would be something I'm concerned about. But every day, if you meet somebody and you get introduced to a friend of a friend of a friend, and you've only met them once 3 years ago, and then you see them in the shopping mall and you think, what is that person's name? That is a completely normal thing to do. Getting lost while driving. So I'm curious, I wish you were all in the room so you could tell me whether you thought that this is normal or not. But getting lost while driving, like the first scenario, can be normal or cannot be normal. So it's normal if you don't know where you're going and you're trying to follow a map and it's someplace that you've never been before, and you make a wrong turn because you misinterpreted the directions that someone gave you. That can be normal. But if you're getting lost going someplace that you should know how to get to, if you're getting lost driving to your daughter's house and you've driven to your daughter's house once a week for the last 15 years, then I would be concerned about that. And that actually can be an early manifestation of a significant memory problem, getting lost on a very, very routine trip. So a little bit two answers to that question. What about not being able to remember the reason that you walked into the kitchen? So this, thankfully, again, is normal as part of everyday life. And thank God, because it happens to me all the time. Why did I come in here? What did I come in here to get? And I think that that's a consequence of a busy life and a consequence of a lot of things on someone's mind and multitasking and doing a lot of things at once. You may think, why did I come in here again? And again, normal, nothing pathologic about that. What if you forget an appointment with someone? Again, I would argue that that's normal if that is kind of you. You know, there are some people who just don't keep great records and aren't really keeping a calendar, and so they've missed things in the past that they should remember. But in general, missing an appointment or two, I don't worry so much about as being a real pathologic finding. This last one is an interesting one, and usually people think that this is abnormal. And the last point is, what if you feel like it takes you longer to answer a question, longer to remember what it is you want to say than it used to? And a lot of people think that this is a risk, that this is something that's not normal. But I think this will be reassuring to a lot of the audience. This is actually a normal finding. The older we get, the longer it may take to pull that memory forward, or the longer it may take to express something important that we want to say. And that's okay. Thinking slowly is different than not remembering. So something to keep in mind. And I see this mostly where the thoughts come a little slower in the population of people who are above the age of 80. That's just anecdotal, but that's usually where I see that. Okay, so we're going to move on to the true or false section of my quiz. All right, so true or false, and again, before I tell you the answer, I want you to commit to it on paper, because I think committing to it makes you think a little bit about it, and it will enforce what you learn and remember from what I say. So true or false, I can improve my memory in the future if I take a class about how to use social media on my computer. So again, normally if we were all together, I'd ask you to raise your hands, but the answer to this is actually true. So why is this true? The way that I want you to think about it is your brain is like a muscle. If you don't exercise it, you will lose its strength, right? So you have to use it or you lose it. So the concept of taking a new class, the concept of enrolling in something and learning something that you've not been able to do before, it's all about continuing to use your brain and use your mind in meaningful ways. Being a lifelong learner just helps to exercise that muscle. Okay, next slide. All right, I love this one. Smelling and tasting a hot apple pie fresh out of the oven during dinner will help me remember things better. So a lot of people say, how can that actually help you remember things better? But the answer to this is also true. Why is this true? So sometimes when there are other senses involved in the memory and not just something that you're reading on a paper or something that you've said to someone, it can help to solidify it. So I'm going to give you an example. Every time in the springtime I smell fresh cut grass, it brings me back to being a kid and playing outside or being at summer camp or having that smell around you. So you see how it can reinforce an experience. So the more senses that you use in an experience, the more likely you are to remember how that felt or when that happened or what time of year it was, whatever it is that you're associating at that time. All right, next slide. True or false? If I just believe in myself, my memory will be stronger. So I'm gonna preface this by saying this is true, but not completely true. Because if it were completely true, how wonderful would that be? We wouldn't have as big a problem with memory and cognitive compromise as we get older. But it is true that our own self-perception of our health feeds into how successful we are as we age. So there are really just three things when you boil down all the different things that we experience as we get older. There are really three factors that contribute to successful aging. One of them, like we talked about here, is a strong perception of your own self-health. The other is a lifetime experience that's significant with exercise. And it actually, I will say, lifetime probably isn't the best word because it doesn't matter when you start. Whenever you start to exercise, it will contribute to success in the future. It will make a difference for you. And the third thing that we need for success in aging is a strong social support network. And that does not have to be family. That can be friends, the people that we kind of choose to be our own families, the people that we choose to surround ourselves with. Having interaction and having support is the third critical factor. Okay, so we'll move to the next slide. True or false? Making a shopping list and using a calendar can help strengthen my memory. So again, I want you to commit to an answer, and then I'll tell you that the answer to this question is also true, right? Why does this help? So similar to that experience we were just talking about with the using multiple senses, the apple pie that's cooking, that's making this memory real for you, you're using more than one way to remember something because you're writing it down. There's a visual component, there's an active component, and that can help you to remember. We recommend, as geriatricians, calendaring as a really helpful tool to aid memory. If there's always one place to look for those answers, it makes it easier to figure out what the schedule is. And even for people who have significant early kind of moderate stage compromise, patients who can still write down those notes, it helps to be able to have one place to refer to. I went to the doctor yesterday. I'm seeing my daughter tomorrow. And for caregivers of patients who have more of a memory disorder, that caregiver can say, when their loved one says, "When did we see our daughter?" that caregiver can say, "Well, open your calendar. What does it say?" And encourage that person to use more than one tool to retrieve that information. Okay. All right, if I repeat something out loud, I'm more likely to remember it. So I'm going to give you a second to commit and record your answer. And then I'll tell you that this is also true, right? It's much like when you meet someone, if you use their name in a sentence, you're more likely to remember their name because you have said it out loud. So this is a tool that people can use to help to retrieve that information. Repeating something someone says to you, again, you're not just hearing it, you're saying it. So there's more than one form of communication that you're using to incorporate that memory into what you're holding onto. Okay, next. If I'm learning something new, I should space out my studying. If I cram, I will never remember what I've learned. So I'm going to ask you to commit, but I think this is an obvious answer. If we all think back to what it was like to be in school, this answer is true. It's really important to pay attention to things. If you're doing 10,000 things at once, which a lot of us do, I know I do, it's sometimes hard to remember one of those 10,000 things that was happening at that time. So really kind of spacing out your time, paying careful attention to things that you want to retain and things that you want to remember will clearly make a difference for you. All right, true or false? I should use mnemonics if I have trouble remembering something. So a mnemonic is like a little trick to help you remember. And I have up here the mnemonic for, one of the mnemonics for how to remember the order of the color of the rainbow. And I remember with a compass, you know, the north, east, south, west is never eat salty worms. I learned it when I was little. But a similar theory, like if you can put something to a problem or a common thing that's easy to forget, patterns, it will help you to remember it. Obviously, it's not practical to use this for everything, but there are even some self-designed mnemonics that can help you remember things that you may find that you have struggled with in the past. So, so this can also be a helpful tool. Okay. This is maybe the most important lesson, arguably, that I'm going to teach you today. And if you remember nothing else, I want you to think about this. This is true or false. If I take better care of my diabetes and my high blood pressure, I can expect a decreased risk of memory problems. And the answer to this is true. And I put this on here and emphasize it in a significant way to all of you because diabetes and blood pressure, for the most part, they have something in common, and that is when either of these diseases are not well controlled over a period of time, oftentimes the patient isn't so aware that it's happening. So this can build, right? Because it's not something, if someone hits you, you're going to feel that pain. But if your blood sugar is elevated for a period of time because you're not paying attention to it before you get into more dangerous zones with a high blood sugar, you may not notice that your sugar is high. So there's definitely a cumulative effect on what happens. To me, when a patient comes in and says to me, I have a little sugar, right? The thing that I always say back is, there's no such thing. Right? And the reason there's no such thing is because we know that tight control of these types of parameters makes a difference for someone's future. Now that being said, not everyone is the same. So we have a saying in geriatrics, if you've seen one 80-year-old, then you have seen one 80-year-old. So I don't want that advice to be taken too literally by all of you. If you have questions about how to best manage your blood glucose or your blood pressure, you should talk with your doctor, because it's different for everyone what that level of management should be. So someone who is older and someone who has more of a frail component should never manage their blood glucose as tightly as someone who's younger without those problems, because of the complications that can arise from being too low, right? So always discuss this with your doctor, but these are really, really important discussions to have. Okay, next slide. True or false? Antioxidant vitamins are good for my memory. So I'm going to give you a second to commit to that. So this answer is false, right? It's not the vitamin in the form of a supplement itself. It is the product, the vitamin, in terms of what we eat that helps us to protect our memory. So there's a lot that people read about antioxidants and their effect on preventing dementia. If you go to the internet, there's a ton of stuff to read. Every time I give a live presentation, there are always questions about this. What supplements should I take? What should I eat, right? So there is some beginning kind of more early but reliable data that things like vitamin E, vitamin C, and beta carotene in our diet, not in a supplement, might be something that is protective. Where do we find vitamin E? In grains, in nuts, like if you had peanut butter toast, egg yolks, milk. Where do we find vitamin C? Mostly citrus fruits, some broccoli, cabbage, those types of vegetables. And beta carotene is more like in kale, carrots, spinach, things like that. So again, it's important that you eat it, not take it as a supplement, because the studies, the same studies that told us that these nutritional sources are helpful also looked at the benefit of supplemental sources and didn't show that same benefit as actually eating these types of things. So I think that's a really important distinction. You know, the industry of supplements is very, very heavily marketed to older adults. And there is a lot that doesn't have a great deal of evidence behind it, and they are expensive. So be careful if you're looking at a product that looks that promises to prevent dementia, right? Be careful, because there isn't something out there, at least not at this time. I wish that there was. And any kind of complementary alternative medication, something from the health food store, something that is marketed to you online, something that a friend says, I tried this, you tried this. I would say the most important thing you can do with any pieces of that information is bring it to your doctor. Say, look, I'm thinking of taking this. What do you think? Right? I think back to years ago, and now it's probably about 15 years ago, I saw a gentleman in my geriatrics practice who was taking a lot of supplements, many of them duplicative, right? And surprisingly was having a cognitive deficit that was erased when we were able to take away all these other things that he had been taking. Because it's important to remember that even though you buy something on your own, from the internet, from the health food store, it's still something that you're taking that can interact with your medications, right? And a good example is something like vitamin E. So vitamin E is a natural blood thinner. So taking it in a supplement, in a capsule, is like taking some level of a blood thinner. And if you're already on blood thinners, that might be dangerous for you, right? So any questions that come up about what you should take, or is this safe for your diet, if you have any question at all, definitely consult with your physician. Okay, next. Okay. I should follow a low-fat diet. This is going to help my memory. Is this true or false? So the answer here is also true. So a low-fat diet can help protect your memory in the long run. And this next slide, I'll give away the answer as we show it. A Mediterranean diet will protect my memory in the future. This is why. So this is really emerging in the literature, the way that people should eat. Lean proteins, whole grains, and healthy fats. Fruits and vegetables, a lot of fruits and vegetables, staying away from high cholesterol foods, fried foods, high fat foods is probably the best nutritional way to help strengthen your memory as time goes on. Okay, next. All right, so I should exercise regularly because doing so will make my memory better, right? So those of you who were listening before know that this answer is true, right? Exercise is one of those things that contributes to successful aging. And like I had said previously, it's never too late to start, right? But if you're starting an exercise regimen, be realistic about what it is you're gonna embark on. Consult a professional if this is something that's brand new to you, right? You can't just get up and run the marathon, but there are things that you can do or build to as larger goals. But any physical activity, any regular physical activity or exercise has been shown to help no matter when you begin. Okay. All right, so here I have circle the medications, and in your case, you'll just be jotting them down, that are proven to decrease the risk of dementia. Right, so what I have here is ginkgo. That's a supplement that has been around for a long time that you can buy in the health food store. NSAIDs, that is an abbreviation for non-steroidal anti-inflammatory medications. Those are things like ibuprofen that you can buy at the pharmacy. Statins, which are prescribed for cholesterol. Cholinesterase inhibitors, which is one of the main classes of medication prescribed for Alzheimer's and vascular dementia, or estrogens. So I'll give you guys a moment to think about that. And then I'll tell you that sadly there is no medication or supplement that decreases the risk of dementia. So I wish there was, and all of these things at some point in time have had some buzz around them. Maybe this will work, maybe this will make a difference. And at this point in time, there's nothing that pans out to decrease the risk of dementia significantly as a sole factor. And some of these things have risk. So again, ginkgo is like a blood thinner and can cause similar problems in combinations with medication. NSAIDs can affect your kidneys. They can affect your stomach if you're taking something not as directed. There are significant side effects to medications, so be careful with what you read. At this point in time, and I wish the story was different, there isn't one single thing that we're prescribing to say this will definitively decrease your risk. All right, so we're kind of coming to the close of my presentation, and this is usually when I assign the essay question portion of the quiz, and which I clearly don't expect that those of you viewing this are gonna do at this moment, but I challenge you to think about this, even if it's just an essay that you write in your mind, right? This question, how does what we're talking about apply to you personally? What, if anything, could you do today to make a change that will protect your memory in the future? Is it making a commitment to exercise regularly, to begin to exercise? Is it making a commitment to change your diet? Is it making that commitment to talk to your doctor about blood glucose control? Are you going to sign up for a class and try to learn something new? What is it that you can do today that you haven't been doing that might make a meaningful difference for you in the future? And then we'll close with a video that I found on YouTube. I love this because it shows us what is possible. Now, I would say, when you see the video, you'll say, are you crazy, Doc? This is impossible for everyone, and it's certainly not possible for me, but it's sort of like, it's inspiring. So this is the world's oldest gymnast. I think she is in her 90s now, and a pretty amazing clip of what she's capable of doing. Really kind of underscoring that age is not a negative factor. It's not something that contributes to the inability to do amazing things. And that's why it's important, coming back to that essay question, for all of us to think about what is it we can do today to make it so that in the future we could do things maybe not exactly like this woman, but hopefully close to it at our own levels.
RWJBarnabas Health. Let's be healthy together.